Hey everybody, it's the Trout and welcome to another episode of the Trout Show. Thank you so much for stopping by. You know, one of the things I hear about a lot, and I'm sure you do too, is about drug overdoses in America. We hear about over 100,000 people die every year from fentanyl abuse. We hear about it crossing the border. We hear about it all the time and how it seems to get worse and worse in America. But are there people actually trying to help change things in America? Well, yeah, there are. And I discovered this wonderful nonprofit organization called the West Virginia Drug Intervention Institute by following one of my favorite organizations, that's Gibson Guitars, and their foundation. They help people out just like this organization we're going to be talking about. I spoke with Susan Bissett, who's the director of this organization, and they talk about their number one thing is to reduce overdose deaths in America. Now, they've only been around for 4.5 years. They are a 501c3 nonprofit, but they're already making huge inroads in that. And she talks about what they're doing, but more importantly, you need to find out, if you want more details about what's going on in America, this is a great interview to listen to and how complex this issue is. It's not something that's going to be easily fixed. But with organizations like this one that we talked to today, we're on our way to maybe making things a lot better. So you're probably saying, why am I talking about this? Well, as I said earlier, I'm a musician. We see this a lot. We've heard about it, drugs, famous people dying of drugs. And if we can reduce that, just think how much talent we'd be able to bring back if they hadn't passed away from drug overdose. So I hope you enjoy this episode. I know it's not the kind of thing you want to hear on the holiday season, but to me, it is so important. So up next, information about the terrible problems we're having with fentanyl drugs and overdose in America. That's next on The Trout Show. When I read about your organization, there's not a lot of mention about musicians and things like that. There's zero, in fact. Mm-hmm. So why did Gibson Guitar come to you, or what was the thing that they, and I pretty well can understand, but what was the thing that they said, oh, I want to help this organization? What was it about?
Well, I think you have to understand a little bit about the Drug Intervention Institute first.
And I want to talk to you about what your organization does.
So the mission of the Institute is really to reverse overdose deaths. And we started with that mission in May of 2018, and I became the inaugural president of the Institute. So we're also a fairly young nonprofit, yep. Although we've had some significant impact in the 4.5 years that we've existed. And so one of the things that we really started working on early on was education. And some of that was prevention education. So we were doing outreach, for example, in the schools here in West Virginia, talking to very young children about medication safety. And we did that after hearing from an assistant superintendent in one of our counties that 2 of our pre-K students had overdosed by taking their grandparents' medication. So here in West Virginia, like many other parts of the country, we have an enormous number of children being raised by grandparents as a direct result of the opioid epidemic. Mm-hmm. And we are placing those children in what we think is a seemingly safer environment, right. Which essentially it is. But what happens is grandparents, statistically, the research tells us that grandparents are more likely to have multiple prescriptions, they're more likely to be prescribed an opioid, and they're the least likely to store their medication properly, which means that we might be taking children from homes where, abuse of prescription and illicit drugs was rampant and pretty normalized, mm-hmm. into an environment where it's not, but the access is increased. And so we really started with that, really wanting to work with young people. And also started doing some education throughout the state on how to use intranasal naloxone. Mm-hmm. And we worked with our Office of Drug Control Policy, our DHHR office, a couple of universities to move that training online during COVID, because our state standing order for naloxone required that everybody be trained on how to use it before they were allowed to receive it, either from a pharmacist through state standing order or an organization like ours, which is covered by the state standing order. And getting to folks to do that training was nearly impossible during COVID. And of course, we saw overdose numbers climb during COVID. Mm-hmm. So trying to find a way
tell people what that is exactly. I know what it is, but in case somebody's listening, they don't have a clue what you're talking about.
Yeah, so intranasal naloxone is a medication which is now over the counter in some cases. The 4 milligram is now over the counter. The FDA has approved it, but it reverses an overdose. So basically, what it does is it kicks the opioid receptors off the brain and immediately revives someone who is having difficulty breathing and who could otherwise die from an overdose.
Okay.
And so trying to find ways to train people, to remove the stigma from using it, to encourage people to use it, we moved that training online. Around that same time, we were working with all of our universities in West Virginia to get naloxone on college campuses. And there was some reluctance on the part of some of the administration because they wanted a training component along with that naloxone. And so that's really how the one box was born and invented, is that the man that invented it actually worked with us on a number of different projects and said, I think I can build a box that not only distributes the naloxone, but provides on-demand training and also provides a long-form training.
Right.
So it's designed to put the naloxone in proximity, to provide that on-demand training in the moment an overdose is happening, and then to train people. For example, if you work in an Applebee's, your employees do their W-2s, they can go find this purple box and get trained on how to administer naloxone. So he invented that and created that, and really the first place we were able to get all of those boxes with the naloxone was on all of the college campuses in West Virginia, and that included public, private, 2, 4-year, all 27 plus campuses in West Virginia now have one boxes in varying degrees. Some campuses are choosing them to deploy them in residence halls. Other campuses have them in every single building on campus next to the AED. And as a result of that, we had other campuses across the country that were interested. Well, the man that invented the box, Joe Murphy, who is from Huntington, West Virginia, which is very much been described as the epicenter of the opioid epidemic, although Joe Murphy, the mayor there, Steve Williams, and I like to call it the center of solutions for the opioid epidemic.
Yeah. So let me ask you, stop here real quick. Two things. What's in the one box? What do they get?
Yep, sure. So the one box is designed to hold 2 doses of intranasal naloxone. It does not ship naloxone because, as you said, we're a nonprofit, not a drug distributor.
Right.
So we work with folks to identify where those distribution points are in their communities, so they can get that naloxone. And then it also comes with PPE. So it has emergency protective equipment in it, gloves, wipes, etc., a CPR mask. And then it contains video instructions. And I unfortunately ran out of the house without one today, but I'm happy to send.
I can pull. I saw it online. I can pull it.
So there are videos online, but you open the box and it immediately plays a 60-second video on how to respond to an overdose in real time. It will play that in both English and Spanish. It will replay it as many times as you need it. And then there's a longer form training video that's about 5 minutes long that's designed to train people as they're onboarding as an employee or a staff member, or you want to go out into the community and train people, you can use the box to do that as well. It is intended to be public facing, so placed by an AED, a fire extinguisher, first aid kit. I often recommend in our standard operating procedure, we actually do recommend that people affix it to the wall in such a way that it can be removed. So for example, our office is in downtown Charleston. Ours are affixed to the wall so that I can remove them should an overdose be happening.
It's kind of like a first aid kit. You put it on the wall.
Very much like a first aid. It's a first response type model for overdose. But you were asking about Gibson and part of the reason.
I want to go back one other thing.
Sure.
Why is the area that you mentioned earlier, the town, is the reason why they have so many problems, that area for drugs? Is that a low income area? Is that?
Well, all of West Virginia is very rural.
Yeah, I knew that. And it's don't you have a lot of coal mines from history and all that stuff?
Yes, and very economically challenged state historically. And so also if you look at the trajectory of the opioid epidemic. We're kind of in a third or fourth wave. But that very first wave, the number of prescriptions that had been written for opioids in this state per person was astronomical. And so you had some communities where there were upwards of 100,000 pills being pumped into those communities in a matter of months.
When you say 100,000, I mean, that's just insane. There had to be a monetary component to it.
Well, I mean, I think if you've watched Netflix and Hulu, you know that that's true. And I don't really need to say that, right?
No, I understand, but
because,
hey.
The media and film does that for me. But if you've seen movies like Painkiller and Dope Sick, you're most folks are very aware of why that happened. And that was really, when I talk about the trajectory and waves of this opioid crisis, that's really how it started, is with prescription pain pills. And in West Virginia, like in many southern states, although arguably some people could say West Virginia is not southern, we were created as a direct result of the Civil War, the only state.
Isn't it south of this Mason-Dixon line?
Yeah.
Yes, it is.
But there is that southern hospitality, very close family, and we all, have a tendency to want to help family. And so I think there was also a lot of, hey, this worked for my back pain. You broke your leg. Why don't you try it? Or you have a headache. And then people got hooked that way as well. There certainly was a monetary component to it. I think that's something that is inarguable at this point.
Sure. And I'm talking about that's the legal side of it.
Sure,
I'm not talking about the illegal side. We know there's money in that. That's why they're doing it.
Sure. And so I think that was our first wave. And then we started to see that being regulated, and doctors and pharmacies getting in lots of trouble for some of those prescriptions, as well as distributors. And so then you had a situation where the pills did not become available, but people were still addicted. And so they turned to heroin. And so we had a wave where heroin was really the primary reason people were overdosing. And now we're in a really dangerous place. Not that we weren't in a dangerous place before, so don't misunderstand me.
Right.
But with the influx of fentanyl, we're not just seeing fentanyl in heroin and meth. So we're not seeing it in drugs that are typically used by persons who are in active addiction. We're seeing fentanyl in illicit prescription drugs like Adderall, which tend to be used and often abused and shared by college students. We're seeing it in drugs that are typically what we would consider, at least in education, as drugs of experimentation, like marijuana and cocaine, that are not necessarily they don't have the same addictive qualities of heroin, and certainly aren't likely to overdose from taking those drugs. But if they're laced with fentanyl, now we're finding people are overdosing. And so we're finding kids as young as elementary and middle school getting vape cartridges online that are laced with fentanyl and overdosing. And so it's no longer just persons in active addiction. We're poisoning our children with fentanyl. And so part of where we've gone with the one box is the ability to put naloxone in proximity of where an overdose might occur, which could be anywhere, but we also know that we have very good mapping systems throughout all of 50 states and the United States of where overdoses are occurring. And so we do have the ability now to place that naloxone in proximity of where those overdoses are occurring. College campuses, schools, school buses, transportation centers. Most municipalities can drill down to zip code and cross streets at where overdoses are occurring.
Yeah.
And so the ability to place that in proximity and provide that training is invaluable in this environment that we're working in. And, I don't know enough about enforcement, not even enough to be dangerous. I'm very much a preventionist. And so in my mind, yes, there are issues we have to deal with enforcement, and we do have to cut fentanyl off at the head at some point. That's a difficult conversation for policymakers, because you're also talking about human beings when you talk about immigration and international relations. But for me, it's about proliferating the United States with naloxone in the same way that fentanyl has proliferated our drug supply. I have two children myself. I have a senior in high school and a senior in college. And we have some pretty serious conversations. There have been documented cases of college students overdosing and dying on college campuses in the last 3 years by taking counterfeit prescription pills. So the opioid epidemic looks different than it did when I started this work. It's a little bit more complex, and it's impacting pretty much anyone.
You know, what's interesting to me is the fact that I'm a child of the 60s, early 70s. This kind of, if you took heroin, you're crazy.
Yeah,
People were smoking dope, and then when Coke came along, it was like, as what did Robin Williams say? If you can afford Coke, it's God's way of telling you you're making too much money. That's the greatest
right.
line he always said. So you'd see people like, I ain't shooting up, just was the mindset was completely different. Now you fast forward to this and you see it's sad, really, in a real bad. You get a drug that is supposed to help people.
Right.
That's why it was invented. I mean, that's why, we could go back and look at opiates from World War I and all that stuff, and people got hooked on them they didn't know. But with the advent of people just, when you said that about people taking their grandparents' medication, I understand that because people don't want it. People in the 70s, 80s, they don't even know they just lose track of what their medication is. They lose track of what they're going to take. So just sitting around, I could see kids, but the mindset is different. If you got kids going in there, hey, let's take some drugs,
Yeah.
that has to be the proliferation of more and more,
Yeah.
info or something they see on TV where they may, grandiose ideas that, oh, look, he's taking fentanyl. Yeah, let's go try it and all that stuff. And then they don't know they're dead.
Right.
And to me, I just think it's one of those things that I don't think people, and this is strictly my opinion, I don't think people realize the impact. And I'm so glad that you talked to me about it because I don't think people realize it. I mean, we hear about it all the time. We hear about it in Washington, D.C. We got to stop the fentanyl coming in the country. But there's nothing, that's all they pretty much do is they talk about it, and they don't seem to understand. I think they do understand the situation, but there's not a lot of enforcement doing it. And I feel sorry for the law enforcement people. They have to deal with this all the time because I've seen them dealing with meth heads, and now
A
you got
lot
kids.
of compassion fatigue, I think.
Mm,
I think it's also hard for those of us that do this work every day. You have to remind yourself that even if someone is addicted, they're still a person and they
right.
deserve to live and they deserve the opportunity to get into recovery. And sometimes that takes multiple, kind of we call it being Narcan, although Narcan's the brand name, but
Yeah, I'm familiar. Yeah.
receiving naloxone numerous times. I was at a music festival that we do here in West Virginia, which is part of how we tied into Gibson. But 2 years ago, I was standing there and I had a young man came up to me. He had come through the tent to be trained on naloxone and receive a 1 box, and he pulled me aside and he said, "Ma'am, I just want to thank you for what you're doing. I had been Narcan 17 times,
Oh my.
and I've finally been in recovery now for 2 years."
Wow.
So imagine if somebody had given up on that young man the
Oh yeah.
opportunity
You wouldn't be
for
having that conversation.
no.
No.
And it was a very poignant conversation and one that I hear often in the work that I do. And we're fortunate enough at the Institute to also hire persons in long-term recovery to do some of our outreach. And I think that's really important because I think it's important for people to see that recovery does happen.
Well, so then, it's interesting you say that because then what happens, I think, he's 17 times. It's almost like this mental, and there against my opinion, I can take it and I'm not going to die because I got Narcan, and they take it and they overdose and they get the drug and then they're back. It's not
Mhm.
like, if you don't have that product available, you're dead. And I think that's why heroin got so bad because people would overdose and they die, and now it's kind of like, well, gosh, yeah, I like it, but if I die, they'll bring me back.
Mm-hmm.
And that's an interesting thing to even think about that you have it, and then you have the situation that you can help them, but you can't, like you said, you can't alleviate their addiction. They have to go into that. They have to change their whole mindset about it.
Well, and I think what people forget, and I think I want to be really careful because I don't want to stigmatize folks, because I think that that's a misnomer. I think that happens less than what people believe that it happens. I
Hmm.
don't think people are actively using and saying, well, if I overdose, people will just Narcan me. I don't think anybody goes into a situation, I shouldn't say anybody, but I don't think most people go into a situation saying, today I'm going to overdose and it's going to
Oh,
be
yeah,
okay.
yeah, yeah. I appreciate, I understand that.
And
Yeah.
we have to be careful about that because addiction is also a disease, and it very
Yep.
much does. There are clinical studies that show that opioids rewire your brain.
Are you confused about what's going on in the financial situation in America right now? What you need is an expert, someone that can help you reach your financial possibilities. And that's David Smith with Everett Jones at 469-372-1587. David has years of experience of helping people just like you, because his number one concern is you. That's David Smith with Edward Jones, 469-372-1587. Reach out to him today.
And, oftentimes when people use, they get stuck at the age where they started using, and it takes them a while to build back some of those skills of resilience and some of those coping mechanisms after they go into long-term recovery. And there's no other disease state that we stigmatize in that way, right? So we have diabetes. There are plenty of people that have diabetes that are walking around that are told they need to lose 30 pounds and they're still eating
Yep.
donuts and drinking Mountain Dew,
Yep.
right?
Yep. Yep.
And they go into a diabetic coma or need wound care, and we give it to them and we don't question them and we don't
No,
vilify them and we don't
that's
say
right.
anything. Same thing with cardiovascular disease. You've had a heart attack, the doctor tells you to quit smoking and you're still smoking.
Yep.
We don't vilify any other disease in this country in the way that we vilify addiction. Arguably, you could say mental health, which is a whole nother podcast
Well, but
topic.
I think that's all part of it. I mean, it's
But
part
yes,
of it. But you
and
make a
there are a
valid
lot of
point.
co-occurring disease states with
Well,
mental
and I
health.
think it's because, and I'm sure you realize this too, it's the way we look at drug addicts, so to speak.
Mhm.
Pictures of San Francisco or downtown, whatever big city you're in, living in tents and squalor, and they're like, oh, I got to have another hit. That's kind of what you look at. But when you start talking about the average person getting it, college students, they're going to
Yep.
college, which means somebody's paying for the bill, even if it's them. They're not sitting there in a tent on the side of the college, and that changes it. But I never really thought about that. Right? There is a huge stigma about it, and maybe that's why people don't jump on it as quickly as they think. That well, they're kind of a better way of saying it. Not really good people. They just kind of low income, low knowledge, and they're just kind of there and all that stuff. But that's not where it's all going. You
Well,
know.
there's a lot to unpack there too,
Oh yeah.
as a woman who grew up in Detroit in the 80s, during the height of what was the crack epidemic.
Right.
I think that there are some racial disparities in the way that we have addressed addiction. I think there are some socioeconomics. There are folks that will argue we never started to care about this until kids in the suburbs were overdosing. And I think some of those
It's a valid
comments,
argument. That's a valid
I think
argument.
it's fair. I think some of
Yeah.
those comments and perceptions are
Yeah.
certainly fair. And so we can't differentiate between the college kid and his dormitory and the person on the street, because what's to say that the person on the street didn't start as the college kid in the dorm?
Absolutely. I agree.
Everybody, is a human being and is worthy of being resuscitated and having the opportunity to go into recovery. So, and it's interesting because I think that's a good segue to talk about the music piece.
Perfect.
Because I think, as a society, when a musician dies, you think about Prince, you think about Elvis, think about Matthew Perry. He's not a musician, but an actor.
Michael Jackson.
Michael Jackson.
Yeah.
The list goes on.
The list goes on and on.
You can go back to Billie Holiday, right?
Yeah, Billie Holiday's a prime example, yeah.
So we revere those people and we mourn their loss because they brought such talent to the world. And so in some ways, I think musicians and actors and people of notoriety have in some ways, I think about Philip Seymour Hoffman, who
great actor, wasn't he?
really made this epidemic for those, not everybody. Fortunately, I have responded to an overdose on a college campus. I hope that not everybody has responded to an overdose because it's a horrific situation.
I'm sure. It's like giving CPR to somebody. It's not like
some people have responded to multiple overdoses. Yeah. But I think for people that haven't had that experience, when you lose somebody who you revered as a star or a role model, that's what really makes it real for you in that music piece, because we've lost a lot of talent. And the man that invented the one box is a musician. And that is how we really initially got connected to Gibson and doing the work with Gibson. And because we were also engaged, the lights are going to go off. So
I know, it's all right, I understand.
The lights are back on. Okay. So we got involved with Gibson as a result of that. And we were working with a group called Hope in the Hills out of Huntington, West Virginia, that put on a music festival called Healing Appalachia, which some listeners probably know the name Tyler Childers. He's from Kentucky, sings a lot about Kentucky, West Virginia. He is now sober himself. But a lot of his original songs on his first couple of albums really dealt with this whole aspect of addiction, and he was instrumental in starting Healing Appalachia. And so we went 2 years ago and as a nonprofit set up a tent at Healing Appalachia and trained over 1,000 persons through the tent on how to administer naloxone, gave them a one box, and then also trained the entire crowd from the stage. And we went back and did that again in September. And we're able to train almost 20,000 persons on how to administer naloxone at one music festival. And, you've talked to Dundee Jarrett from Gibson. And so it's not that we believe that, music festivals there's more likely to be overdoses at music.
No, but I understand.
Other place. They happen at sporting events. They happen all but, it's just that is, a sector, if you will, of where we've had a lot of loss due to addiction, and so much talent is lost because of that. And so that is really when we started to engage Gibson with a partnership, and we're able to give away some Gibson guitars at the festival. Gibson provided some goodie bags for us to be able to distribute during the festival, and that really started the partnership. So when Gibson called about a year ago now and said, we'd like to put naloxone in one boxes in the downtown live music venues in Nashville, Joe and I jumped at the chance to be able to make that happen.
Sure.
We both have a very soft spot in our hearts for Nashville in general, but him being a musician and me being a music lover, and us being connected to some of the musicians. And we've established some great relationships with people beyond, Tyler and his band of food stamps. Jason Isbell now has a one box. Tommy Prine, John Prine's son, is a huge advocate for the one box. We've been able to get the one box in the hands of artists like Macklemore. So we've really tried to work to bring awareness so that one boxes can be in live music venues, in arenas, at festivals, so that folks are trained on how to use naloxone should, unfortunately, someone overdose at one of either at one of those events or around one of those events.
It's become more prevalent and available. I think that's the other thing. If you can pick it up and not worry about, hey, I got to go down the corner and get some dope. No, it's not like that anymore.
Well, I think COVID didn't do us any favors either with the isolation. I think we had, people that were in recovery of all kinds, whether it was, for heroin, alcohol, whatever the case may be, even cigarettes, that picked those habits back up out of the isolation. And there were folks that had never done any of that before. I have friends that started drinking very, very heavily during COVID as a coping mechanism who were not heavy drinkers before. So I think that isolation was a huge piece, and it really brought us backwards. We were starting to see pre-COVID those numbers declining, and then we had COVID and an even stronger influx of heroin in the drug supply, and those numbers started to skyrocket. And so, it's very difficult. Like I said, this is a very complex epidemic, but what's simple is, and not to minimize it, but getting naloxone out there so that anyone can reverse an overdose. It's not that difficult. It shouldn't be that difficult. We shouldn't be making it difficult, and we need to make it happen. And that's what Dendy and his group are doing. Through Gibson Gives, there's that group Tempo, training and empowering musicians to prevent overdose. There's several organizations, including my own, that are a part of that group that are really trying to get naloxone and education and training and one boxes in particular in these live music venues. And since we started the music project in Nashville, we're now seeing it expand to Kentucky, parts of Kentucky. We're now seeing it in Athens, Georgia. We're now seeing other states and other municipalities that have a large number of live music venues want to take on similar projects. And I think that's amazing. Just in the small number that we distributed in the last year, about a total of 8,000, we have had people self-report about 120 saves with the box, and those are self-reported. So that's not us going after people and saying, we're doing some of that work too. But just people coming back and sharing the story. The first set of boxes we gave out at Healing Appalachia 2 years ago, like I said, we gave out 1,000 boxes. That first year, we had 37 people report that they had used the box just out of that 1,000. So it's obviously needed. It's obviously necessary. But also getting rid of the stigma. I mean, naloxone should be as commonplace as aspirin or a Band-Aid. You cut yourself at work, where do you go? You go to the first aid kit.
And it's like AEDs. They've come out now that you go a lot of places. Hell, they're on planes now. You just have an AED on the airplane. And now you see them more and more, which is a good thing. And they're so sophisticated. Now, I've been through CPR training more than once, but still, you still want to have that instruction, things like where do you put the paddles and all that good stuff. Now, I did see online that you do sell the one box. And so it was funny. When I saw something about shop, I thought, I'm so used to dealing with musicians, like, do you think they'll have T-shirts?
But I can probably get you one. Who do you want?
I need merch, and it's like, so the thing about it was, I go, no, Rick, they're selling, and I saw the one box and stuff like that. What do you want people to know to support? Because you're not just, I know you're in West Virginia, but you're doing more than that. So somebody's sitting there and they're listening to this going, what can I do to support your efforts in some way, whether financial or something? Tell me what you think.
Well, I think it's interesting being a nonprofit and being in the world where you're selling a product, because people kind of always go, what are you really doing? And so I think it's important for people to know that, as a nonprofit, the box is very mission specific for us. Our mission is to reduce overdose deaths. We started out as the West Virginia Drug Intervention Institute. We're now the Drug Intervention Institute because we're very focused. We have one boxes in 40 states and 3 countries right now.
There you go.
So we really do have a national footprint. We're very razor focused on Appalachia. West Virginia is the only state that's completely in Appalachia, and so we want to take care of our front yard, our backyard, and our side yard first, which is really important to us. And we understand the disparities that exist in Appalachia and are interested in raising folks in Appalachia up. So that's a big piece of the work that we do. But all of the proceeds or sales of the box, as you will, go right back into the Institute's programming.
Sure.
And so we are, for example, we just produced a documentary with West Virginia Public Broadcasting that will be aired on national PBS with
cool.
Middle and high school students about their experiences with substance use and mental health that will probably blow some people's minds in terms of what these kids have to say. And I think it's important that we hear what they have to say so that we tailor and adapt our prevention response to what they're saying. We have our program, Don't Keep Rex Around, which is a medication safety program designed for pre-K, and then we have another curriculum for first and second and third and fifth. And those are also going to be live soon on the PBS Learning Lab website.
Okay.
So those will be open access to schools, communities, et cetera, at no charge. We also, do naloxone distribution in the state of West Virginia under the state standing order. We've distributed over 100,000 fentanyl test strips to all 55 West Virginia counties, and that's just in this last year because fentanyl test strips were still considered drug paraphernalia until June of this past year. So
I don't.
kind of a no-brainer,
Yeah,
right?
yeah. And
So,
how do they use the test strip?
so
I
the
saw
test-
them on your website too, but how do they use it?
So the test strip is actually designed to test the drug before you take it or ingest it. And
Oh,
so you
okay.
use a
Okay.
small amount of the drug with
That's
water.
why they were thinking. I got you. Yeah.
And so, we don't distribute those outside of the state of West Virginia, primarily because every state has different regulations about
Right.
these testing strips, which we've talked to folks at the national level about. That nonsense needs to stop, so that we can get as many of these out there as possible. But we do a lot of prevention and education work, and without, the ability, the box helps us to advance our mission, obviously, of proliferating the country with naloxone and putting that in proximity, but it also helps to inform our mission, which is to reduce overdose deaths, but then it also helps to support the Institute moving forward so that we can be a self-sustaining organization. We don't typically do any annual fund drive or things of that nature. We do have a holiday fund drive in November and December, and we get some very small donations from that. And we're very thankful. And if folks want to do that, we encourage them to do that. In fact, if they go to our website, the pop-up is for that holiday fund drive right now.
No, I did see that.
Yeah, and people get to choose kind of, get to understand if they give $25, here's what it would support. If they gave $100, here's what it would support.
Okay, great.
We also go after grants to place one boxes in communities. And so I'll give you an example. In West Virginia, we received a grant from Aetna Better Health of West Virginia and Vandalia Health to purchase one boxes and naloxone and place those and make them available in every elementary, middle, and high school in West Virginia. It is an opt-in process. School boards are at county control, and so it is very much up to the county whether they want to opt in. But out of the 55 counties in West Virginia, we have 33 currently participating in placing one box in schools, and the school nurses are a big part of that. And so we're very proud of that initiative. Another grant has allowed us to offer one boxes and naloxone and tailored training to all of the public libraries in West Virginia. And so that's been huge. And we have over half of the libraries in the state currently participating. We've also worked to get funding to put them in all the federally qualified health centers, which are health clinics that often offer primary care, but many of the clinics are also offering medically assisted treatment for addiction. And so their populations are particularly vulnerable. And so having that available, we have homeless shelters. There's actually it's not really a shelter per se, although they do have those services, but they offer many services, including healthcare, to persons who are experiencing homelessness in Huntington, West Virginia. And they use the one box to train people on how to use naloxone, but they've also used it at least 25 times to resuscitate and revive people, bring them back from an overdose. So there's a lot of grant writing that we do to place the boxes too. And so oftentimes when a community calls us and says, I really can't afford, my budget won't allow me to get as many boxes as what I really need, we say, okay, what grant funds are available in your community, and we'll help you develop the language so that you can write that grant to get them there. So that's a goal that we have, and we try to work with community organizations as much as possible, because to us, getting them out there is what's most important. And I think one of the things we haven't talked about is the box is purple. The box is purple for a reason. Purple is overdose awareness recovery color. Purple makes the box look very non-intimidating. Doesn't necessarily look like it looks enough like a first aid kit that you know that it's there for medical response, but not so much that it looks intimidating, right? And so we want to eliminate the stigma. And so we use the hashtag find the purple box. You see an overdose happening, find the purple box.
Actually, that's pretty smart.
You want to train all of your employees,
find the purple box,
fill out their W-2, go find the purple box and do the training. And so we very much want to normalize naloxone being in places where overdose might occur, which could be anywhere.
Well, that's it for this episode of The Trout Show. Thank you so much for stopping by and listening, and my special thanks to Susan Bissett with the West Virginia Drug Intervention Institute for coming on and talking about this problem in America and how they're trying to solve it. If you'd like to consider supporting this wonderful organization, you can visit our website at wvdii.org. That's W as in Victor, D as in David, II.org. And also shout out to David Smith with Edward Jones for continually supporting our show. And remember, if you want to know more information or visit and listen to or watch more of these Trout Show interviews, you can do so by visiting our website at thetroutshow.com. Until next time, people, you remember what I always say. It's only rock and roll. But I love it. Happy holidays. See ya.